I will go ahead and move that House File 2033 be laid over for possible inclusion in the HHS Division Bill. Representative Lippert.
Thank you, Madam Chair, members of the committee. So in my other life, I'm a pastor, and one of the things I do is walk with members of my congregation who are wrestling with substance abuse. And I've learned a few things. One is that good treatment is essential for the pathway to recovery. And I've also learned that the time after treatment is incredibly important for recovery too. That the road to recovery is long and winding, and it's not one that one should walk alone. The more support that can be there, the better off someone will be as they're putting their life back together. And so I'm glad to be here presenting this bill, providing funding for recovery community organizations. They're independent nonprofit organizations that honor all pathways to recovery. They're not treatment providers, but exist to fill gaps in and around treatment, which is typically a short-term intervention. They offer the primary care essential to managing and preventing the chronic disease of substance abuse disorder. So this bill will direct $975,000 in each of the next 2 fiscal years for grants to recovery community organizations. And here with me to say more about the work that recovery community organizations do is Wendy Jones, the Executive Director of the Minnesota Recovery Connection.
Thank you, Representative Lippert. Please introduce yourself to the committee.
Thank you. Thank you, Madam Chair and committee members, and thank you, Representative Lippert, for authoring this legislation. My name is Wendy Jones, and I am a person in long-term recovery from a substance use disorder. Recovery has made it possible for me to be here today as the Executive Director of Minnesota Recovery Connection, and on behalf of the Minnesota Association of Recovery Community Organizations. So the legislation before you today replaces an existing appropriation, modifies some language, and is a slight increase to the appropriation. More importantly, though, it ensures that Minnesota's current network of recovery community organizations can continue to deliver essential peer recovery support services, and that the door is open for more communities to establish local recovery community organizations. So Minnesota has recovery community organizations in Rochester, Mankato, and the Twin Cities. And recovery community organizations are emerging in St. Cloud, Duluth, Moorhead, and elsewhere. As Representative Lippert pointed out, recovery community organizations are independent. We're nonprofit organizations, and we're led and governed by representatives of local communities of recovery, including people in personal recovery, or family recovery from substance use disorder, and the professionals who serve us. Our board of directors, our staff, and our volunteers are all people from our local recovery communities. And as Representative Lippert pointed out, we're not treatment providers. We fill gaps in and around the treatment system. And we are a critical and highly cost-effective part of the behavioral health continuum. People need to maintain recovery and improve their lives before, during, and long after treatment. The funding from this legislation will support the broad range of peer-based recovery support services provided by recovery community organizations that are not otherwise eligible for Medicaid reimbursement. Examples of these services include training people to become recovery coaches and peer recovery specialists, using a strengths-based approach that honors all pathways to recovery. It includes providing one-to-one peer coaching for people outside of the treatment system, partnering with correctional facilities, treatment courts, emergency departments, first responders, and others to reach populations outside of the treatment system. It includes telephone recovery support, peer support groups such as All Recovery Meetings. It also includes on-call recovery navigation, supporting individuals and families in finding housing, employment, education, and healthy social activities. It includes public education to reduce the stigma associated with substance use disorder, and it includes continuing education and support for Minnesota's emerging workforce of peer recovery specialists. So these and other peer-based recovery support services are an evidence-based health model of care. They are proven to increase recovery outcomes and decrease costs, significantly reducing instances of relapse, hospitalization, incarceration, overdose, and death. I have a stack of research which I could share with you, but I know that we're on time limitations here. Minnesota has over 400 licensed treatment providers, but only 6 recovery community organizations, 4 of which emerged in the last year in response to the demand for our peer recovery support services. Most of these services are provided at no cost to consumers. In addition to losing the substantial investment already made in these recovery community organizations, Minnesota cannot grow and sustain a network of recovery community organizations to match its network of treatment providers without continued investment in recovery. Nationally, there are no successful networks of recovery community organizations that operate without ongoing state support. So at a time when Minnesota needs accessible recovery support services more than ever, we thank you for supporting this legislation to sustain and grow our recovery community organizations. Thank you.
All right, thank you very much for your testimony. Are there questions from members? Representative Schumacher.
Thank you, Madam Chair, and to the bill author or the testifier. You mentioned that the $975,000 was an increase from previous allocations that were made. Can you tell us what that amount was and the increase, is the intent with the increase to go to just cover kind of inflation since the last time there was an appropriation, or is it going to expand the program?
Ms. Jones.
Thank you. The increase is it's an increase of $250,000 per year for a total of $500,000 for the biennium, and the increase is intended to enable recovery community organizations to expand. There's a demand for more recovery community organizations, particularly in greater Minnesota, and we are hoping with the support of the existing recovery organizations that we can help build additional recovery community organizations.
Representative Schumacher. Okay. Representative Loeffler.
Thank you, Madam Chair, and Representative Lippert about, I think it's great that we build aftercare supports in a variety of different ways. I had a chance yesterday to meet with a constituent of mine who is a peer support specialist. And we talked about how we have now competing models, and yet peer support services, some have experienced a really common situation of both mental health and CD crisis. Some have only had substance abuse as a challenge. Some have only had mental health. But her concern was that we are getting into really specialized language, and so that people who may have had that dual diagnosis experience and really be gifted in helping with that, she works professionally in crisis, are being closed out when we use recovery support specialist, and if we might be able to work to a uniform term, and that different agencies would hire people with different backgrounds depending upon what their clientele is and their needs. And so I'd just ask Ms. Jones if you and Representative Lippert, if you'd think about that, I'd be glad to bring her together with you to further explore this. They've just created a professional organization that one hasn't existed for these roles and professions, so that they can support each other in training and peer-to-peer support. And so I'm hoping that as this moves along, we can consider that, because we have so many people who are dual diagnosis and who really do need someone who understands what the complications are of recovery from that, not just from one or the other.
Ms. Jones.
Yes, thank you for Representative Loeffler for bringing that up. We are well aware of that, and we work closely with the Department of Human Services to support them. There is currently movement within DHS to clarify language around peer recovery support. There are currently peer specialists who address mental health and peer recovery specialists who address substance use disorder, and we are promoting co-occurring training to enable peers to address both disorders simultaneously. One of the advantages of peer recovery support is that an individual has that lived experience with either substance use disorder or a mental health disorder or both. And it's that lived experience that makes them so effective in helping individuals navigate their recovery. So I can tell you at this point that it is an ongoing topic, and we are working closely with the Department of Human Services to ensure that peer support of all shapes and sizes is available and effective.
Representative Loeffler?
Thank you, Madam Chair, and I will continue to pursue that with you, and not just with the Department of Human Services, but also others who are involved in this, because I think it's a really important support that has proven effective, and no matter what the issue is. And I think the more that we divide things up, the more it becomes difficult to actually meet real needs of people in the community, as opposed to blending opportunities. And if you're only working with people whose only issue is substance abuse, of course, you're going to focus on those peers. And if you're focusing on a blended clientele, it might be nice to have a blend of experiences in your peer team. And so we don't need to continue this discussion here. We'll have it offline. But thank you for your work, and I support this effort.
May I respond, Madam Chair?
Jones, yeah.
Just very quickly, I should clarify that recovery community organizations accept all people who come to them, so we never turn anyone away because of one particular disorder or another. Our goal is to work with the individual to find what meets their unique needs and then connect them with resources that may be more specific.
And Ms. Jones, I have a question as well. I don't see any from any other members. You know, we have this thing called Results First now, and I wonder, and excuse me if you already addressed this, because I had to step out at the beginning of your presentation, but have you looked to see whether Results First has any information about the model that you are using? And it's fine if they don't, but I just kind of, you know, asking whether people use that resource, and maybe you've contributed to that resource.
Thank you, Madam Chair. I am not familiar specifically with Results First and the direct connection with peer recovery support and recovery community organizations. I do know that there have been substantial studies from SAMHSA and CMS and in other states where the state single state agency works in close partnership with their RCOs that demonstrate substantial improved outcomes and cost savings for peer intervention.
Okay, all right, well, thank you, and I just, and I know Representative Lippert, you probably wouldn't have thought to do this, but, you know, if that Results First, maybe we could talk offline. It would be great to have, to at least know what they've got, whether they have the information you're talking about. Maybe they haven't evaluated this, but I kind of think they might have something that pertains to it. So thank you for that. Any other questions from members? All right. Oh, okay, seeing none, Representative Mann renews her motion that House File 2033 be laid over for possible inclusion in the HHS finance bill. So the bill is laid over. Thank you very much.